Yeah.
Thank you so much for
Glad.
having me with you today.
Yeah. Thank you for coming.
Okay,
And
somebody else, it seems, is sharing a screen, so it's telling me I cannot share a
No, no. So
screen.
I'll just introduce you.
Dr. Desai to introduce you, and then you have to share the
Okay.
screen. Okay.
Okay, thank you so much.
A brief introduction of Dr. Jackie Kassouf, Maalouf. She's a founder and president of Dialab, the National Diabetes Organization, a leading diabetes organization in Lebanon, and which she founded with her daughter Sylvie, living with type 1 diabetes in 2010, and has been the president since. She holds a PhD in public relations and communication from the University of College in Virginia. She made it her mission in life to advocate for those living with diabetes and delivers educational and motivational talks especially to the recently diagnosed. She has 10 years of experience in leading the NGO's awareness campaigns and activities across Lebanon, and she holds a diabetes educator certificate and participated as speaker at many local, regional, and international diabetes conferences. Prior to running Dialab, Dr. Maalouf taught at the American University in Beirut and the American University of Culture and Education, and continues to offer training sessions in different topics. Dr. Maalouf has been an active board member of the Lebanese American Renaissance Partnership LARP since 2014. Her book appearances include The 100 Most Influential Lebanese Figures Around the Globe, published in 2017, and Women Pioneers in Lebanon and the Arab Region, published in 2010. Dr. Jackie, you have a lot of experience, and we are very honored to have you here on this dais, and you can go ahead.
Thank you so much. Allow me really to thank the organizers of DiaCareCon for inviting me to be with you. It's really an honor to be speaking about this topic, which is very dear to my heart. You've all heard that I have a daughter with type 1 diabetes. So I think it's a life mission for me. I hope to take advantage of these few minutes to discuss very important topic, which is the diabetes education. And we all know it's a key to, one second, I need to fix my screen. It's a key to preventing diabetes complications. What I'm going to be discussing today is few diabetes education facts, the role of education. Of course, we're talking diabetes education, the role of NGOs, being myself a president of a diabetes association or an NGO in Lebanon, the role of NGOs in diabetes education, and the NGOs activities model. And I'm going to be talking about Dialab, an association which I'm very honored to be the president for the last 10 years since its foundation. A very short literature review, and then a diabetes survey by Dialab. It's our first study. It's not published yet. I'm going to be sharing with you a few of the results, and then conclusion and take-home message for our attendees. So if we're going to be talking about few diabetes facts, and we know that in today's world where the health challenges are bigger than ever, greater than ever, we come to realize even more than ever the importance of education and its role in the prevention, treatment, and especially management of diabetes to prevent the complications. Of course, we all know that diabetes is a very serious and life-threatening disease. However, it can be well managed through proper treatment and control. And when I said about today's challenges, of course, I mean the pandemic and the more challenges than ever that we are facing. We hear a lot recently about diabetes self-management education, DSME. It plays a vital role in the management of diabetes. It is crucial for the patient, especially, to be aware of the nature. What is my treatment? What are the doctors giving me? About the risk factors, and most importantly, the complications of the disease. As we see and we all know, of course, diabetes affects our whole body. many of our organs, and diabetes-related morbidity and mortality are primarily attributable complications, many of which can be potentially delayed or prevented. Which means, in other words, it's a shame to have someone lose a limb or lose his or her sight if we can prevent that. That's where the role of education it plays in the prevention of diabetes itself and in preventing the complications. The education plays a role in early detection and diagnosis of diabetes, in the enhanced management of the disease itself, in better outcomes and therefore prevention or lower incidence of complications, and definitely, and most for all, better quality of life. Diabetes education must be targeted at different audiences, and this is what we're going to be talking about, educating the community, educating the patients, and educating the professionals. And we don't mean by that that the professionals don't know, but maybe they don't know enough about diabetes. So we know that this is the year of the nurse, and nurses are in many cases the only medical professionals that many patients see. So nurses should have enough understanding of the warning signs. So if they see those signs, they should refer the patient to the specialist or anybody from the medical care who could take care of them. Nurses and diabetes educators must understand the disease and its implications in detail in order to effectively and efficiently support their patients. We've seen cases when students come to our associations to do internship. Let's say they are a senior year studying nutrition. They have a minimum knowledge about diabetes. So we don't want our future professionals, let's say our future dietitians or nutritionists, to stress on making people losing weight. We want them to stress on making them live healthy to prevent diabetes and other diseases. And if they don't have diabetes, to help them live healthy, to prevent those, and if they have them, to manage them in a better way. Diabetes education must be, again, targeted at different audiences. Here is the key point. The diabetes patients, they need to know what's going on. I've seen it many times during our awareness campaigns. They don't know what is the medication. They need to call the daughter or the son to take a picture of it to tell us what he or she are taking as medication. Most of diabetes management is self-driven. So this is a must for the patients to know not only what medication they are taking, what is diabetes, what are my risks, what am I facing, what am I up against if I continue with the trend, let's say if I have a high HbA1c. So the patient is left to make proper lifestyle decisions, which include taking the recommended medications, incorporating exercise, making nutritional choices, and with that, they need help. Education is key to support patients in making those right choices. For type 2 diabetes, and it is the majority, 90 to 95% of the total cases of diabetes in the world, so we are talking about huge numbers in our populations. Education can be a catalyst in lowering the rising rates of the disease in type 2 diabetes. Diabetes education is an important component of diabetes treatment, and the goals include providing information, but not any information, the proper and accurate information and knowledge to enable patients to self-manage better. Changing patient behaviors, we all know this is the most difficult part, and the patterns, and talking here about lifestyle, changing the way they eat, and motivate them to do more physical activities, not necessarily to run a marathon, but to be active. Also, the goal is to support patients to comply with medical and nutritional recommendations. Again, I've seen it a lot. Some patients say, I heard insulin makes me put some weight on, so I decided not to take it. It's not a decision of the patient. They need to comply with what the doctor indicates in those cases. And here is our message for today. Education is key in preventing complications. Keeping blood sugars in range is key to avoid potentially deadly complications of diabetes. People with blood sugar levels closer to normal, and this I've seen it in many studies. I'm not going to name them because you're all aware of that. Those people have fewer complications when the sugar is well managed. We at least delay, if we cannot prevent, all the complications. Managing blood sugar levels involves continuous monitoring, making good lifestyle choices, and ongoing treatment. Again, talking about type 2 diabetes, it is important for patients to understand that diabetes, if mismanaged, and I have this in bold, only if mismanaged, increases the risk of other diseases. The most common of those diseases is the cardiovascular disease, which can lead to heart attacks or strokes. However, this cardiovascular disease can be avoided or, as I said, delayed by many years only by taking simple lifestyle changes. If we smoke, we need to stop smoking. We need to watch our diet. What we are eating affects our health, and to lower the A1C levels. And here's again a key point. Some patients consider it a mission, impossible mission, to lower their A1C. They need to be educated and understand that if they lose 5 to 7% only of their body weight, they can lower the A1C by 1 point, and we all know how important this 1 point is. How important is diet and exercise for type 2 diabetes? Diet and exercise are the foundation of diabetes management, the key, the pillars. However, the common public does not have the necessary knowledge of nutrition to make the right dietary choices. Let's say many people ask me, what is the diet for people with diabetes? And you need to explain there is no diet specifically for people with diabetes. You just simply have to follow a healthy diet. Good for me, good for you, good for someone with diabetes, and for everybody. But they need help to make those choices and to understand what is a healthy lifestyle. Traditional foods and ways of eating are not always conducive to diabetes management. So here again, they need the help of a professional or someone from the Diabetes Network Care to be helping them take the right choices. And we all know about today's sedentary lifestyles, and those are not helping. They are making people lazy, they're lowering the exercise and physical activity, which is not good for our health. It is important to educate people about the importance of exercise and the need to introduce it in their daily activities. And most of all, in our education ways, we need to make things simple. We need to understand that people from the community living with type 2 diabetes, and again, I've seen that a lot throughout our awareness campaigns, they need a simple language, nothing complicated. They need to understand what are the steps in a very easy way. I start talking here about the role of NGOs in enhancing diabetes education, and that is absolutely a continuous process. We don't do it today and stop it tomorrow. Patients need continuous information and reinforcement. Many of the concepts of nutrition in diabetes management are new, and therefore they cannot be learned in the 15-minute visit to the doctor. We all know that the doctor wants and have the goodwill to help the patient to the maximum. But let's be realistic, the 15-minute or 20 minutes doctor's visit is not enough, and that's why education should be continuous. NGOs and diabetes educators can play a key role here to fill the gap, so NGOs can provide continuous education and diabetes awareness to fill this educational gap. Talking again about the role of NGOs in enhancing diabetes education, I'm going to mention the role of Dialab, which is a leading diabetes organization in Lebanon, founded 10 years ago. I'm going to mention only our educational programs because we're talking here about the importance of education. First and foremost, the patient support sessions. Psychosocial support, peer experience, this is very important to give them the tools they need and the moral support to go on. They need to understand I'm not alone, especially those living with type 1 diabetes, and I've seen it amongst our members. And allow me to mention here that after the unfortunate Beirut blast in August 4, we've seen a lot of depression in people, especially in those with diabetes. Add to it the pandemic and the fear of getting COVID-19 and not knowing what the nasty consequences may be, especially for those with diabetes, having the contradictory information coming out every other day. We really needed to do very frequent support group sessions for our members in order to help them stay sane in this difficult situation, as we've had a lot going on in 1 year. Prevention and general awareness are in the core of our mission at Dialab. We have a program called Diabetes in the Classroom for schools and universities, as we believe education should start at a very early age to allow our children and youth to lead healthy lifestyles. Diabetes in the community targets mostly people with type 2 diabetes, and most of them or some of them don't know they are living with diabetes. We do know that. And we have the internship programs, and here we believe in educating our future professionals, letting them see firsthand what they need to do when they become our professionals. Educating the educators, and here I mentioned the scientific conferences like we do every year on the occasion of World Diabetes Day, and of course that is all with the support of our scientific committee. We address it to doctors, nurses, dietitians, fitness instructors, and diabetes educators. Promoting exercise, those activities include marathons, exercise sessions, hikes in nature, and this is a very simple and easy way and fun way to motivate them to lead those healthy lifestyles. I'm sharing with you a couple pictures to let you know, but I'm going to mention here that some of the topics we insisted on during last November, where we intensified our campaigns on the occasion of World Diabetes Day, we addressed mainly dietitians and nurses in believing that they need to broaden their knowledge to better handle their patients when those patients are living with diabetes, whether type 1 or type 2. I mentioned to you the patient education session and the patient support groups, and those are very much needed. When I mentioned continuous information and accurate and proper information, I'm sharing with you here the issues of our Dialab Review magazine, which is used to be distributed free of charge. We stopped this year, 2020, printing it, and now it is only available online, downloadable version, of course. In it, you can see from many professionals, it's like a 90 pages magazine, both in Arabic and English, to make it easy for all our viewers to see and understand and benefit from the important information. And all the people you see on the cover are real people. They are our members living with diabetes. And if you look at this one, I don't know if you're seeing my cursor, this is my daughter Sylvie with her 2 boys, and she is really a motivational speaker and motivates many of our members to go on, as she is a married lady. She's living with type 1 diabetes, managing well her diabetes, and she is also our managing director at Dialab. All the activities that I mentioned are working toward the goals, the sustainable development goals of the UN. Especially, we focus on goal number 3 related to good health and well-being, and goal number 4 related to gender equality. As we all know, diabetes touches equally men and women. A very short literature review, something that called my attention related to preventing diabetes complications through education. In a study published in 2005 in the medical journal, the extracted data indicated the importance of diabetes self-management education, again the DSME, in the promotion of health practices that could prevent or delay potential diabetes complication amongst persons with type 2 diabetes. But I would like to mention here that this study speaks about type 2 diabetes, but also for people living with type 1 diabetes, managing well their diabetes, understanding well the disease helps them prevent all complications. Another study published in 2009 by the American Diabetes Association, ADA, highlights the importance of education in preventing and delaying the onset of diabetes. And here's the study I mentioned in the beginning of my presentation today. This is a study that Dialab did. It's a survey actually, and now we have the data analysis of the survey. We conducted this survey across Lebanon, and we gathered information about diabetes. It was a bit broad. We had 18 questions in this survey, and it was distributed to public from all ages, all demographic areas. We also had our members participate in it, and some of the results reflect that. I will share that later on with you. Our sample was 2,000 participants. It was between the year 2018 and it stopped 2020 early stages, and now we are analyzing the data. Something that called our attention, and I wouldn't really stress on the percentages because a big number of our members did the survey. So of course we see a 24% in type 1 diabetes, but this is not really the reality of all Lebanon, as prevalence was not our target. We were looking for other things in this. But what I would like to stress on the most, since we are talking about diabetes education, we did ask different questions related to how you are managing your diabetes, what type of medication, oral or insulin or both, how do you monitor your blood glucose sugar, and we came up with some of the results that really called my attention. If you look with me at the first line, type 1 diabetes, it's 56% only shows insulin and 22% said they were taking pills. Now, of course, we do know that someone living with type 1 diabetes cannot manage taking pills. So this is an eye-opener that either those people most likely did not know the difference between type 1 or type 2 diabetes, because it's actually impossible to have this high percentage of people taking pills and living with type 1 diabetes. We also noticed that only 4% of those living with type 1 diabetes are using the pump, where others prefer to do the daily injections and not use the pump. 17% of those living with type 1 diabetes are taking both oral medication and insulin injections. And in the other questions, also we noticed that taking the oral medication was mainly to help them lose weight in order to better control their A1C. In those living with type 2 diabetes, we noticed that 12% only are taking insulin, which is good, as we want them to rely more on making an effort in doing exercise, changing their lifestyle. And we have only 4% that you see here without medication or insulin. This is what I think we need to be stressing on, to educate our population to rely more on their own efforts to control their diet, to do a little bit more physical activities in order to control their diabetes, rather than to take so many medications and then at the end add the insulin to it, which I'm not saying is wrong, but if they can live without it, then it's much better. Pre-diabetes also was an eye-opener for us. We all know that everybody nowadays is stressing on the importance of educating people while they are in the pre-diabetes stage, because at that stage they can have it reversed. We see here that 80% of the people who said are living in the pre-diabetes stage, 80% of them are taking pills, whereas only 20% are living with no medication at all. This is also an eye-opener, and I think we need to stress more on educating this segment of the population so they can do the extra mile and they can understand better what are the simple steps that they could change in their lifestyles in order to better control the prediabetes, reverse it, and not become diabetic patients in the future. Of course, we have many more results in the study. I only shared a few points and few slides with you. We are going to be publishing it soon. The conclusions and the take-home message is, first of all, we must become more involved and perform our essential role to save the lives and reduce healthcare costs. We know that the complications are the highest cost of diabetes everywhere in the world. I'm not going to go through numbers, but I do know, let's say here in the US, where I am now for the holidays, they have the budget for diabetes and diabetes complications is higher than the budget for cancer. Dialab has made it a priority to inform, educate, and assist patients, caregivers, and communities through our multi-channel awareness and prevention programs. Most importantly, we aim to improve the quality of life. This is a very tricky point. It's not a matter of surviving diabetes, of living with diabetes. It's the quality of life that we need to pay attention to. And we like to help our members and our patients keep their diabetes under control to prevent the complications. The cost effectiveness of diabetes self-management training or education, DSME, and medical nutrition therapy to treat diabetes are being adopted by more patients associations as well as care centers because the results are obvious if we see all the studies done on this topic. The value of patient education is evident from research demonstrating that patients who never receive diabetes education are at increased risk of a major complication. So the key is in our hands. We see the results of the studies. Those who have not received diabetes education are at higher risk. We need to educate more our populations so we lower the risk of the complications. The basic objectives in the handling of type 2 diabetes mellitus patients are reaching normal metabolic control and preventing complications. At the end, I would like to say that the intensive efforts to increase awareness amongst health professionals and individuals living with diabetes to improve diabetes management through education are urgently needed. I'm not saying it's not happening, but they are urgently needed to be more spread, more into our population's mind that they need to be educated to control the increase of diabetes, as it provides a useful benchmark to plan future strategies in diabetes care. And at the end, the COVID-19 pandemic makes it a must to double all efforts and to pay more attention, especially to mental health. I'm mentioning this because, again, we've seen it amongst our members. This side should not be neglected, and it should be an essential part of educating the population, educating the patients, and educating the professional teams, the mental health side on top of all the other information. I would like to thank you for listening attentively to what I had to share with you. Here is our social media portals where we put all the information that our professionals and our scientific committee work very hard on. And thank you so much for inviting me again. Allow me also to wish everyone happy holidays and healthy holidays. Let's all hope that